this is going to be one of my favorite sessions. We talk a lot about accelerating innovation in a variety of different areas. Pediatrics is not something we talk about a lot, but pediatrics is one of those areas which is one of the most accommodating to innovations, because almost everybody who has children in the hospital are usually younger folks, right? They're young parents, et cetera, and they are very, very interested in using the best technology available. And so they will seek out these innovations and say, if hospital A is using a certain innovation versus hospital B, they'll go to hospital B versus A. So I think there is a great deal that we can learn from the pediatrics environment about how to identify and select these innovations and then implement them in ways that will be immediately applicable to saving children's lives, but then use that as learning on the adult and non-pediatric side itself. With that, I think, Omkar, are you on already?
Hello.
Hi, there we go. All right, so as soon as you guys think you're ready, I'm going to let you guys take over. Omkar, are you gonna take off?
I'm ready.
All right, great, go for it.
All right, well, good morning, good afternoon, depending on where you are. Thank you for joining us for this session about pediatric innovation. Specifically, we're calling it the collaboration across the ecosystem to accelerate innovators in pediatric health. So we're joined by two great leaders in digital health and innovation from Dallas, Texas. I think is that where you both are currently right now? I know we're all in different places, but Mickey and Ronak, maybe do you want to introduce yourselves and what you do at Children's Health of Texas?
Sure. So my name is Mickey Fokin. Glad to be here, everybody. Thanks for having us. I'm the director over the Care Delivery Innovation Lab here at Children's, and that's basically a lab that we advocate for innovation related to digital health. And so that includes generating and exploring ideas that come from within, but also staying connected with the startup community to keep our organization informed of the latest developments that might be able to benefit our patients.
That's great. I love the work you do, and you've done a lot of. We'll talk about it in a minute, but the work you've done with schools, the work you've done with telehealth has been really pioneering in terms of when you started and how long you've done it and the scale of which you've done it. So excited to talk to you more about that in a second. Ronak.
Hi, everybody. My name is Ronak Aswati, and I'm a program manager in the Network Development and Innovation team. Are you guys getting some feedback, or is that just me?
Can hear you fine.
So I develop and manage our chronic care app. We have a diabetes advisor. As of last week, we have asthma. These apps are meant to empower our families to really take part of their own condition and give them access to education and all the things that they need to better manage their asthma or diabetes.
That's great. Well, let me start with you, actually, Ronak, and ask you some questions about some of that work. So it seems like you've started with specific chronic conditions and chronic care conditions that are important in peds. What made you start with diabetes and asthma?
Diabetes and asthma are probably two of the biggest conditions affecting the pediatric community. And we had clinical champions as well that are wanting to partner with us on an app. So the idea was to really create niche apps that were tailored to this specific audience and the ultimate strategy of creating a larger organization.
Okay, that's great. Mickey, as you think about innovation within your health system at first, and also just broadly in pediatrics, walk me through how you think about prioritization of different potential ways in which we could innovate, right? I think you and I have talked about this before. I think there's so much that we could do that it's hard to sometimes figure out where to start or which ones to start with. So how do you approach that topic down in Dallas?
Sure, and it's funny you mentioned that, because right now we have about 75 ideas in our portfolio queue, and it's tempting to just want to pursue them all. Say, yes, that's a great idea. Yours is great too. Oh, yes, yours is great too. So we do have to go through a process of reviewing which ones we want to pursue, things that are able to impact the most number of patients, things that we're able to demonstrate the ROI. And then also we have to think about, is the juice worth the squeeze? So is this a big lift, something that we can do in-house, or is it something that we would need to partner with a third party to make it happen? So by combining, the return that we would get along with the amount of work that it would take, that helps us determine the prioritization. And then the other element that impacts is how does it align to strategy? The nice thing about our innovation lab, it reports up to our executive leadership over strategy. And so we work very closely in terms of talking with our leadership and finding out what are the pain points that they are trying to address. And then we hone in our efforts and our time to focus on those pain points. And then at that point, we're able to collaborate with internal partners, IT, digital team, virtual health, development team. And that's always a cross-departmental effort to be able to address these needs.
Follow-up question for you. So I think but first of all, I agree, and I think a lot of those same things apply to me as well in my role at leading innovation at CHLA, at Children's LA. The question for you, I think this topic was specifically about collaboration and the need for collaboration across pediatrics. Before we talk about KidsX, just generally, you've been in this space for a while and you've seen a lot, and I always see you at all the conferences, and you seem to be very active in this world of collaboration, Mickey. What are your thoughts about why pediatrics needs that element of collaboration, maybe even more than other parts of healthcare?
Sure. So it's kind of interesting because we collaborate at the local level. So within the Dallas-Fort Worth area, we're pretty connected to the innovation ecosystem there. And then we also collaborate at the national level, like you mentioned, connecting with other pediatric innovation centers. And I think in short, the reason collaboration is more important than peds is the fact that when you look at the patient marketplace, pediatrics or children are anywhere from, depending on who you ask, like 25% of the population. So if a company has a healthcare product, they're going to focus on the adult first just because it's a bigger market. So when we have a pain point and we're trying to solve that pain point, we look at that and see, okay, is this something that already exists in the market? If it exists in the market, great. Then we're able to move forward and partner with IT. Okay, what if it doesn't exist in the market? Then at that point, are we going to create it ourselves or are we going to partner? Apps, yes, like Ronak mentioned, we have a good track record and a lot of the good work that she and her team has done. We can create apps and address those needs. But what if you're talking about like virtual reality or an AI model? Or what if it's a digital solution that requires the FDA process, like a digital therapeutic or a medical device? Those we're not going to be able to create ourselves internally. So in those cases, we try to get the attention of the companies to be able to create these solutions. Now, sometimes we can get their attention just by our single hospital or healthcare organization. But sometimes we can't get their attention to create the solution. And so this is where it helps to partner with other pediatric hospitals. By unifying with our other pediatric hospitals across the US, we've now increased the potential market from just our small area to now a national market that'll get the attention of a company to create the product.
It's a really good segue to talking a little bit about KidsX, which is a program that we're both a part of. So KidsX, for the participants on the call and those watching at home, it's an international network of pediatric hospitals and health systems from mostly across the United States, but also in Canada, Europe, and Australia as well. And we've all come together to say, kind of like what Mickey was just saying, we have a need. We've got a sizable part of the market. It's not tiny, no pun intended. We've got a sizable part of the market that has needs from a care delivery perspective. We have many of the same needs that our kind of adult healthcare counterparts have as well, but the needs are different, right? So the needs may be similar, but the way in which the technology needs to be delivered is different and applies differently. The users are different. There's parents involved, which is not necessarily the case for most adults. There's just a different dynamic that needs to be taken into account. And so we need technologists and entrepreneurs to work with us in a sense. And we've had a similar experience that when we work with one-off entrepreneurs just by ourselves, we're not really often able to get the attention of many of them to really build something that we need. But through this network of 40 some odd pediatric health systems, we believe that we can actually get the attention of startups, of the investor community, of the health plans to really start coming up with what we envision is, pediatric digital health. And so the program that we've built is focused specifically around adoption and how we can work with promising startup companies, partner them with hospitals like my hospital, Children's Hospital Los Angeles, Mickey's hospital, the hospital Mickey works at in Dallas, and many others, and see how we can best adopt these technologies in an accelerated fashion into our organization. So excited to work with you guys on that, and hopefully many others around the country. Ronak, I want your thoughts on the one specific element, and I'll ask you the same question, Mickey. In the pediatric space, it sounds like you're focused on chronic condition, chronic disease management, but even broader than that, or what excites you? What are exciting innovations that you think are needed, or are ones that you're seeing on the horizon?
So I have a public health background, and I've always been really intrigued by tailoring a specific, whether it's health communication or a technology or any kind of health campaign to a specific population. I think that's kind of what it's all about, right? Is meeting people where they are. So if it's an app, you're in everyone's home. If it's telehealth, we're in their schools. I think for me, what's really exciting is the use of mobile apps, not just as a tool for education to connect people to PDFs that we create in-house or any other educational content, but I'm really excited about like an interactive care pathway. I would love to see, based on whatever a patient's diagnosis is, when they leave the hospital, 3 days post-discharge, they'll get a message, asking how they're doing, check up on patient satisfaction or anything like that. And depending on whatever the diagnosis is, let's say you have a vent trach patient, we could send a video 1 week post-discharge that shows them how to clean their trach or things like that. I think that really unique, tailored messaging where when we integrate with an EMR, that's really what excites me. We're kind of on the cusp of that as an organization, and it's really exciting to kind of see the pieces coming in place. But I just think mobile apps are the future, and it's part of not just our consumer experience, but the health experience as well.
That's really helpful. I have something to come back to about schools, but I want to first ask Mickey the same question broadly about what are you excited about? What do you see as from a leader in a pediatric organization focused on innovation? What are you excited about? What do you see coming down the pipeline?
Sure. So from our organizational perspective, anything that can help keep patients at home, whether it's keeping them well so it doesn't escalate or it's avoiding a readmission, is a big win. And then when they're here, anything that can help them recuperate and recover and leave and discharge as quickly as possible is also a benefit to them, their family, and then also to our hospital because it keeps beds open for other children. I mean, DFW is one of the fastest growing regions in the US, and so we need to be able to keep up with that demand. Are doing a lot of good stuff. Now, if you were to ask me personally, if I wanted to nerd it up for a second, and the thing that I like the most,
please do.
I get pretty excited about autonomous delivery. And so when we're talking about self-driving cars or drone delivery of medications or of medical supplies, just the other day we were talking about, okay, you have a patient, great, we've done a good job with telehealth to keep them out of the house, and we have the e-prescribe where the medication can be sent to their pharmacy, and that's all automated. But a lot of parents are still going to the pharmacy to pick up the medications, even though that pharmacy delivers. So how can we as a health system help out in leveraging technology to deliver the medications to their home? Now, you could use a human, but that takes a lot of time and money because that's not as scalable, especially when you're talking about a $4 or $5 antibiotic. You can't pay a $15 delivery fee. So how can automation lower the cost of delivery to then further make that sustainable and scalable, so that way we can deliver a med for maybe $1 or $2 per delivery instead of $5, $10, $15. So that's kind of my personal thing I get excited about. But there's still some movement needed on the regulatory side and the testing side. So that's still a few years out before it starts expanding.
Well, on that front, we're just, I guess, nerding out here. But with that same kind of drone autonomous delivery thing, especially right now with COVID and COVID testing and with rapid testing kind of coming out a lot more quickly now, part of me wonders about that too, right? If you have centralized labs that can quickly, process at scale lots and lots and lots of COVID tests, could you use autonomous, drone technology to kind of pick up specimens in different places and move them back and forth? I think that is happening in places, but I wonder if that could happen at scale.
Exactly. That's the need. There's some interesting pilots going on. The closest one for self-driving cars is down in Houston. And then the closest one for drones, I want to say that was in the Carolinas. They were doing some work out there. But like you said, if we could leverage a centralized testing, I know there's some companies getting into robotics around COVID testing to try to automate it. They're in some early phases around that. But if you could automate it from end to end, maybe that'd be able to speed up the testing window and reduce exposure.
Yeah, Mickey, like you alluded to earlier, I think the regulatory side is still trying to catch up to the technology side. And I think that might be one silver lining of COVID, is that that's kind of accelerated a lot of that to kind of minimize contact.
That's a great point. You're right.
It should be interesting to see what happens. We were just having a conversation earlier this morning about kind of when we're on the other side of this, whenever that is, and however you define it, there will be everyone's focused on telehealth and what happens with that, and I'd love to get your thoughts on that in a minute. But there's other things that I think we will have done, in whether we know it or not, in healthcare that could either continue or not. I mean, like, for example, in our organization, we've done a variety of services curbside. Curbside pickup for medications, curbside flu shot or vaccinations, things like that. And some of the need for that shifts a little bit, but I think this concept of convenient, we were already shifting from a consumer standpoint towards more consumer driven healthcare. And I think some of the elements around distancing and curbside and things along those lines may accelerate some of those kind of needs in the future. And, self-driving cars or drones can definitely help with that too. Thinking a little bit more near term, I know our KidsX program has, one of the things I like most about it is that we work together to figure out what our common areas of interest are. And these are on the website, by the way, for the participants listening to this, which is kidsx.health. And if you scroll to the bottom of the homepage, you'll see the what we call our wish list. But if I remember correctly, this is a good memory test for me. But those wish list items are basically the things that we've identified as the kind of innovations that our pediatric members, our fellow hospitals in this consortium, are most excited about seeing. So things like remote patient monitoring was top of the list, looking at ways in which we can better coordinate care for patients with complex conditions or complex illness was another. There was a topic specifically around virtual rehab, whether it's physical therapy, speech therapy, occupational therapy. How do we leverage digital tools to support that? I think there was a problem we all identified about the high rate of cancellations for procedures in our hospitals, whether it's surgery or outpatient procedures, and if we could better prepare families before surgery, both emotionally but also logistically, to make sure they're prepared so that we can avoid the unnecessary cancellation. I think we talked a little bit about, one of the things that was interesting that popped up on that list was around the transition from pediatric to adult healthcare. I don't know if either of you want to talk a little bit more about that. I know that it's something that coming new, when I came into the pediatric innovation space, that was a topic I hadn't thought about and wasn't aware of. And it's clearly a very big issue that occurs across the country. I don't know, Mickey, if you want to talk a little bit about that, or Ronak, about this challenge of the transition between the two.
Sure. So we've actually included transition of care in both our diabetes and asthma apps. The idea is we want the child to now be the person that's managing and tracking their symptoms and entering in their blood glucose levels or whatever, whether it's for diabetes or asthma. The idea is to make them more self-sufficient and give them all those tools that they need so that they don't have to ask mom and dad, so that they can do that themselves. As part of, I know organizationally, transition of care is something that is very important to us, making sure that children have access to providers. I love that. I just saw Mickey's son run in the background. Making sure our kids have access to providers, or how to fill a prescription, how to use your insurance, things like that, that we kind of, don't take for granted, that we take for granted. And especially, I think about really vulnerable populations as well, like foster care populations that don't have that, that guidance from their parents to help them navigate this. So I think we could really look to mobile apps to help us with a lot of that.
Thank you. That's really helpful. And we're seeing some really great applications come through that do exactly that. So it'll be interesting to see how we then, choose them and adopt them into our organizations. One of the other ones that was on the list that I wanted to talk to you about was how to better coordinate information sharing between parents, hospitals, doctors, and schools. Right. So the school, for many of us, it's obvious, but others it may not be. It's a really important part of the kind of child's ecosystem when you think about their health, right? They spend a lot of time in school, maybe not today for many of us who have hybrid setups or virtual setups, but traditionally that's where kids are. And so you all have done some groundbreaking work around partnering with schools in the Dallas area. Share some thoughts around that whole care coordination piece and why it's so important.
Sure. So, first off, hats off and kudos to our school telehealth team. They have done some amazing work. I think I last heard we are up to near or slightly over 200 schools that we are collaborating with through our telemedicine program. I believe that coordination is critical. We've taken that first step of giving access to our clinicians via the school telehealth program. The child's at the school, they report they have an issue, it gets them connected via telemedicine, and afterwards an e-prescription is sent to the parent's pharmacy of choice, and the parent is included in the process throughout. But I think there's additional opportunities for continued collaboration between the schools, between us and the doctors, especially around sharing various care plans. So like Ronak mentioned, if someone was just discharged and then they're finally getting back into school after recovering from home, how are we keeping that school informed of that customized care plan? So wouldn't it be great if there was an app where the parent has a care plan, but then the school, for their 8 or 9 hours a day, they have their part of the care plan and the things that they're part of, but it's done in a way, and this is really important. Before Children's, I worked at a company that sold technology to schools. It's gotta be streamlined, it's gotta be easy to use, and it can't take up a lot of their time on their end. You can't ask them to say, hey, thank you for agreeing to help. Now here's a portal. You're going to have to log in. You're going to have to click 15 times. You have to scroll down. And by the way, you're going to have to sort through the 50 kids that have active care plans that are going to your school, So it's got to be very user friendly and include a lot of their input to make sure it's integrated into their processes, because they are crazy busy too at the schools, especially now given everything going on.
They are, and they don't have the staffing they need, and it's a complicated piece. One of the things we're starting to do, and Mickey, we can talk about this as well. We've just included Los Angeles Unified School District as a member of KidsX, and it'd be great to see if the Dallas school districts and others are interested. But I think bringing the school district on as part of this ecosystem is really important from a KidsX perspective, because I think we can't solve everything just with the hospital systems, right? We need the health plans, we need the investors, and then we need, for the care delivery side, we need schools. And so hopefully we can get more schools involved in this effort as partners, because kids are there all day, right? So how do we leverage that relationship to, better enable digital health? The two other items, I had to look it up just because I wanted to make sure I didn't forget, but they're very important and probably obvious to people. One is around mental and behavioral health. We are seeing, like our colleagues in the adult healthcare space, this is a major access issue, gap in care, because we just don't have enough providers that can provide behavioral health. So however we can leverage technology to augment or supplement the existing really powerful provider network that exists of behavioral health would be really valuable. And so there's a lot of tools we're looking at, leveraging AI and technology, either to directly provide care or some elements of care, or to supplement care or to support care to make it more efficient. So there's tools that we're looking at there. And the final piece is around AI and predictive analytics. How do we leverage data to better, predict? Mickey, you and I have talked about an early warning system for kids and why that could be so interesting. I'd love to hear your thoughts on it. But there's so many other ways in which we could leverage data, both in the hospital and outpatient, to predict, outcomes for kids before they happen, so we can ideally intervene early. I know you've looked into this work, Mickey, and maybe you can shed some light on it.
Yeah, sure. And this is where it starts really benefiting by having the KidsX organization. Because like you said, when you start getting into things like AI and pairing that with digital tools around behavioral and mental health, you got to have a big enough population to effectively train the AI model. And our organization by ourselves wouldn't be able to have that big enough population, not even 2 or 3. We really need 10, 15, 20 different hospitals to be able to provide the data. So that way, not only can you train the model on the biggest population, but let's remember all the subset populations too. We want to make sure that we have equitable access and representation in the technology tools. Some of the things that I've kind of seen coming around, and you kind of inspired me to maybe suggest some of these companies to apply to KidsX. The things around that's using AI to be able to recognize depression. So imagine if you had an app that provides just basic education, or maybe it has a care plan between your therapy sessions, and it has this little buddy that can be on and say, hey, I noticed you may not be feeling all right today. Are you okay? Do you want to talk to someone? It's not diagnosing, but it's like kind of spurring, hey, maybe this person might benefit from talking to someone. So that's a one example of many where it could interact and help encourage them to get to the right point of care. Other things, you start thinking about like Amazon Alexa or Google Home. How can that be a digital buddy or a digital friend that can help keep them on their care plan, but also be informed and be aware of might they need help? But of course, all these really neat things have to be done in the right light of, are they perceived as invasive? Are they perceived as crossing that line? And when designed, it needs to be done in a way that it's welcomed by the family and it's trusted and it's something that they would want to use. So having that voice of the user is such an important part of this.
That's great. And I think we're about to wrap up. Just on that last note, one of the things that we're excited to do with the program with KidsX is partner with the ICANN network that I know Amy and Leanne lead. And what we're looking to do is basically incorporate feedback for all of our startups that we're working with in this program during the accelerator from actual kids and parents, right? How do we build a network of kids and parents to provide actual user feedback on the actual product or on the concept of a product, right? Around privacy and invasiveness and things like that. So before we, I think, open it up to kind of Q&A, just a last little plug. Applications for KidsX are due in a week from today. Go to kidsx.health and you'll see all the information about the program and how you can join. We've got an amazing set of hospital members, including Mickey and Ronak's team in Dallas, as well as our team in Los Angeles and 39 others. So I think it's a great program, and we'll have quite hopefully a bit of important things to share this time next year around the kind of progress we're making with some of these innovations. I think, should I go through some of these questions on the side? Okay, Mickey and Ronak, I'll see how we divide this up. So
actually, let's start with one, Omkar, which is there is the nature of KidsX is slightly different with the reverse pitch and some of the other techniques you're using. Why don't you talk about that? What makes it different than the myriad of other opportunities that are out there for startups and innovators to, quote, compete?
Yeah, so I think there's a few things that I'll talk about. Thank you for that question. So one is, there's a lot of amazing accelerators out there, and some of the people on this call are leading many of them. So we didn't want to duplicate any of the efforts that are happening with other organizations, right? There's great accelerators that can help a company build a good startup. They can help build a good investor base. And that's just not the focus area of what our program is. Our focus area is specifically on adoption. How do we take really motivated health systems like the ones on our call today, and who are interested in digital health, and pair them with the right startups that they can, in a short period of time, accelerate the pace of that adoption, whatever that work that happens typically a startup meets a hospital person like Mickey or Ronak or I. We shake hands, or in COVID worlds, I don't know, we virtually high five. And then there's this dance that happens. Sometimes it takes 18 months to just go through all these steps just to get something off the ground. And what we're trying to do is condense that. First of all, create a transparent process that makes it very clear what needs to happen in Dallas, in Los Angeles, wherever, to get the technology from introduction to adoption. And we're trying to then condense that so that it happens in parallel and in sequence, and then put some, transparency around it so that both sides know what they need to do. So that's one element of it. The other is this point of reverse pitch. So, we feel like it is a disservice to just take interesting applications and startups and just pitch them to our hospital members, just because we all know that at the end of the day, we have CFOs we work with, we have strategy people we work with, and they want to make sure that the work that we're doing as innovation leaders aligns with strategy, aligns with our, financial pressures and our business goals. And so we've asked our hospitals, look, what is it that you're really interested in that you would actually put resources towards? We don't want to just bring you shiny objects and say, oh, this is nice. Because eventually what happens in those types of setups is down the road, maybe 6 months from now, someone has the uncomfortable conversation with the startup that says, you know what, this is cool, but we don't have the budget for this, or we don't, we're not really that interested. So we're trying to preview our short circuit and get rid of all that and say, what are the problems you need to solve? So those 8 wish list items that we reviewed on this call, they're on our website. They were generated by our members, right? So we had a whole 4-hour session. Mickey, you sat through it. And we identified all those needs that our hospitals had. We voted, and then we came up with those. So that's another element. And I think the third element that I think is unique, Shahid, is the ecosystem, right? So we really believe that we want to have not just hospitals, but we will also want to include members from health plans. We want to include the school districts, the investors, really build a whole ecosystem around what's needed here, so that ideally these companies can not only get traction with providers, but also perhaps figure out reimbursement through health plans, figure out an investment strategy through investors, figure out how to partner with schools and other kind of sites of care in the community. And so ideally we can set them up for success, because we know that it's not just a one-on-one type of relationship when it comes to innovation.
Yeah, I think you're exactly right. So the challenge in these kind of innovation scenarios is there is real demand, there is demand intent, the intent to demand something. Then there's everybody else. Like there's just a supply side here that is just going in, and the vast majority of supply side folks are going to fail, right? Because they've never spent any time in hospitals. They don't know what the environments are like. So there are carcasses on the road to innovation for decades now because the demand wasn't there. So if I was advising you guys, I'd say focus on the reverse pitch, because that is truly innovation in the innovation category. It's only been around for about 10 years, but it does work where it's at. And related to that question, Mark Lowe had asked a question, what are some of your considerations when assessing the ROI of proposed projects? That might be a great question for you guys to deal with as a panel, maybe as a last one, because we're actually out of time.
Sure. Well, so from a KidsX perspective, I can start, and then I'll answer from a CHLA perspective, and then I'd love answers from Mickey and Ronak as well. So it's part of our roadmap, right? So we want to make sure early on, once we've identified the clinical need and the clinical work, that I think around week 4, we will set constructive meetings between our hospital members and the startups around really calculating what that ROI is. Ideally, it's a hard ROI, something with financial things associated with it, or efficiency plays, but it could also be quality, experience, other things that are important to our organization. So however we define it, we need to be very clear about it, and we need to make sure that our pilots are structured in a way that they're demonstrating that they're at least achieving or aligned with getting those ROIs. And that's often how we do things at CHLA, and so I think we're kind of applying some of that same framework here, and it's not... We interviewed many of our hospitals in our network, and that's how they do it as well. So we kind of took what's best practice amongst our hospitals and said, okay, well, let's use that same framework around ROI evaluation with our startups in this accelerator. Mickey, Ronak, how do you guys do things with return down in Dallas?
Ours is really similar to what you mentioned. I'll just add the layer that when we have a pilot or a trial that we want to do, we need to submit it through an executive approval process. And in that process, there's a field that talks about what measures are you going to use to measure the success. And so we just want to make sure that when we're setting up the pilot, that it's set up in a way where we can deliver on those things that we talked about.
Right. I find the ROI question, it's always kind of funny to me because it's so, you can't put you can in a way, but how do you prove the efficacy of an app? How do you prove the efficacy of making someone more educated about their condition? It's kind of, you can't draw a direct line to it. So I think what I'm interested in is kind of like we track certain patients over a long period of time. We do a lot of surveys, pre and post test, to gauge whether or not a certain piece of educational content was informative to them. I think that obviously there has to be, the execs want to know numbers, how much it's going to cost. And I work with the developers and then I work with the clinical side. So I'm always kind of trying to toe that line. But I find that the health outcomes really are our biggest return on investment.
And I think the last piece here is some of the elements of return are going to be on the health plan side. They're gonna see the returns if these kids are not as sick or they're taking care of their health better and whatever else. And so that's why we're trying to slowly incorporate health plans into some of these conversations, because if there is a reimbursement mechanism or a cost savings or something, it may not be immediate. We're not going to get that in 13 weeks, but we should start having those conversations, because some of these tools, if they're scaled to various markets, there could be an opportunity for a health plan to somehow participate.
No, that was a great answer, and Ronak, you're spot on with this idea that ROI is difficult, because what does the I mean? Is it a return on investment? Is it a return on innovation? Is it return on an initiative? Right? I mean, who knows what the heck ROI means? And I promise we didn't plan it this way, but we've got Dr. Samir Badlani, who happened to have raised his hand, and he can help answer some of this, because the organization that he's with, called Node Health, the Network of Digital Evidence, has been formed as a nonprofit for many years now to answer this very specific question about how the heck do we know that the thing that we are trying to put into digital use actually works. And maybe that's what we mean by return on investment. So it just worked out perfectly, Samir. So just give us a couple of sentences about yourself, where you're coming from, and then maybe give some thoughts around this particular question: is how do you assess the ROI on these innovation projects, whether they're in pediatric or not, and anything else you'd like to share. Go ahead, Samir.
Sure. Thank you, guys. Appreciate the opportunity to be on the call with you. I'm not gate crashing your panel. I just want to acknowledge that up front. I did have a chuckle when, Ronak, you were talking about those executives. I am one of those cold-hearted executives.
I didn't say that.
Okay, I'm just teasing. I do that with a lot of pride. But today I'm here to represent Node Health, as Shahid introduced us. The entire goal of Node Health is exactly what the last portion of the conversation is. We're investing billions of dollars in digital health. There is a lot of hope and aspiration that all of us have, that this is one thing that will make a difference. But how do you know something works? And how do you measure efficacy? Because I think all of us run into really smart, intelligent, committed folks who want to make a difference using technology, but which one do you choose to bring into your health system? How do you define a POC? So the Node Health Conference is happening in December 7th to 11th. Obviously, it'll be virtual this year. I have the privilege of being the committee chair for from an organization standpoint. And I just wanted to extend the invitation to everybody on the call, to all of you on the panel, to think about participating, supporting, and being part of the conversation. In my day job, I am a clinician. I don't actively practice. I'm now the Chief Digital Officer for mHealth Fairview. Omkar and I had a brief conversation about 2 years ago when I was at Sutter Health, and really enjoyed talking to Omkar then. And from my standpoint, it is our responsibility to define what the ROI will be, whether it's money, quality, safety, experience upfront, almost like what is considered good evidence collection, because we are putting in a lot of time in all of this. And I look forward to a lot of conversations in this space. And again, would love to have you all part of the Node conversation. December 7th to 11th, and I will post the website on the chat as well.
Samir, just to build on that, so it's funny, I just talked to Ashish this morning, and so we are actually thinking about ways for KidsX to
That would be wonderful.
In Node Health, and perhaps even do a little conversation, maybe an update from where we are once we've looked at our applications and things. And we'd love to find ways for Node and KidsX to work together on this important topic about measuring and evaluating the success of digital innovation, right? You guys have a lot of expertise in that space. And so Ashish and I were brainstorming how we could leverage the Node brain trust in supporting the KidsX initiative. So hopefully this is more to come from both of our sides, and looking forward to the conference you guys are putting on in December. I know I'll be there.
No, that sounds terrific. And in fact, one of the reasons why we wanted Samir to come up on this video is to talk about the innovations and evidence around it. But one thing I wanted to do, maybe just as a wrapping a couple of questions, and Samir, you're welcome to keep chiming in here as well, is what are the kinds of things that pediatrics innovations needs that maybe the adult side doesn't need? Or is it everything that's happening on the adult side easily transferable to pediatrics and vice versa? So I'd love to talk about that, because we do have a bunch of innovators in the audience who are like, what can I do to help on the pediatric side for innovation? So anybody want to take that question on? Is there anything specific about what you need in pediatrics that is different than in the adult world? And John Donnelly asked a particular question: can panelists share their experiences, if any, of the use of medical devices at home for post-acute or chronic condition oversight is any different for pediatric care, or is it the same as adult?
Sure. So I could just share a couple of things that come up in conversations. One is, and Omkar mentioned it before, with pediatrics, you have that dynamic of having a parent and a child. And so if it's a digital solution for an older child, like a teenager, it might be a solution for them, and you're just keeping the parent informed. But if it's a solution for a younger child, like under the age 13, then the user is the parent, not necessarily the child. And then on the device side, there's definitely some differences. For example, there's many years where we were running into a challenge of not having a remote patient monitoring device that can be used on newborns. Quite frankly, the adult devices just didn't fit. And you have other issues around skin sensitivity and things like that. And so just the fundamental aspect of size difference is also a big element. And then the last part I'll share is we're seeing a growth around the remote patient devices collecting data and then running that data through some AI to provide some suggestions, whether it's risk profiling or whatnot. And so that data and the calculations used and things like that is a lot different for a pediatric child versus an adult. I mean, it's similar in terms of like pharmacy and medications. The dosing is significantly different. They're not just, tiny adults. And so the same with like sensors and AI, that's going to require their whole own algorithms.
Great. And that's, Omkar, maybe as you talk with Samir and the team at Node, those are the areas to focus on, because when we're looking at evidence, the evidence tied to children's products must be and should be different in many cases. And that would be something to help have the team at Node Health help you guys with if necessary. And Ronak, from your side, do you see any differences in addition to what Mickey mentioned that maybe he didn't?
No, I think Mickey covered it. It's really interesting though, because you do have within the pediatric community, you'd have the adolescents and up that can manage their own devices, and then the ones that need parent help. It's we run into with RPM, the biggest barrier I think we ran into was internet connectivity. That was such a huge issue for a lot of families, because our children's hospital is in Dallas and we service. I mean, some parents were coming in from 3-4 hours away. And so when we send them home with this device, with the whole RPM kit, they feel this sense of security, like they're tied to us. They have this direct line to their healthcare team. But when it doesn't work, when the video calls drop and the data is not uploaded, it makes them kind of lose faith in not just the product, but the system a little bit. So I think it's important to make sure that we have all of our, in dealing with RPM specifically, all of our tech in line.
Yeah, and Omkar, what I'd love for you to do is it was your panel. I'd love for you to summarize it with this one last question. Is that in the previous panel there was a question about how do health systems involve parents, children, extended family members, et cetera, in the education of these tools, technologies, et cetera. So my guess is that that's even a bigger problem in the pediatric side, is because you have all these things. You can't just assume that kids know how to use this. So you have to teach the adults and the children. How are you guys doing that, Omkar, in LA? And then please add any summary remarks that you want to bring in, Ronak and Mickey, and then we'll close out in the last couple of minutes.
Yeah, so I'll answer that question, and I want to add a thought to the previous question about it kind of syncs up a little bit around why pediatrics is different.
Sure.
And what we need. So if you think about why digital innovation across the country has really been enabled, largely, specifically with adult populations, it's largely because of Medicare. It is my opinion, at least. So Medicare allows for one element of a reimbursement strategy that is across all 50 states. There's some variation, and it's large. And the population is one that, of course, is fairly costly in terms of its expenditures and its cost. So Medicare has been a big driver of that. Now, as you all probably know, a lot of the public version of that for pediatrics is Medicaid, and it is different in every state. The way it's administered is different in every state. So it creates a fairly sizable barrier for a company that's trying to figure out its reimbursement strategy across the country. Right. So what works in Texas is going to be different than what works in California, and so on and so forth. So that's a fairly big barrier that I think we need to figure out how to better leverage, because, again, if Medicare was the same, where every state had it very, very differently, I don't know how quickly a lot of the innovations that have succeeded in the adult space would have succeeded. So that's a challenge that we have. And then to your education question, this is the other part of it. If you think about the senior space, right, the people over the age of 65, and you look at the demographic makeup of the 65 and over population, and then you look at the demographic makeup of the under 18 population. The under 18 population is so much more diverse, so many more languages spoken or languages they're exposed to. It's just a different demographic than the over 65 or over 70. And so just that element itself, when it comes to how we're educating people about apps, when it comes to how we're thinking about language options that are available within a solution, it's just very, very different. Even cultural competency around how we're building tools. If you look at a demographic that's under 18 or even under 12, it's a very, very different population that is in our youngest population versus our oldest. So that kind of plays a role as well in terms of pediatrics and some challenges that developers and technologists need to think about. That it's a different population that has a different set of needs and a different reimbursement framework because of the way healthcare is paid for in this country.
Yeah, that sounds great. Excellent. Samir, go ahead.
Sorry, that's just a fascinating point. I definitely learned something being on the panel. Never had thought of it, the reimbursement and the demographics that way. I think one other thing I'll add, putting my CIO hat on, is the rules around privacy of information are very different in the pediatric population, and again are different for younger kids versus older adolescents and kids. So there is that. And then there is just a heightened sensitivity around privacy. Sometimes the reaction to a certain information sharing is different from what even the law requires. So I think it's a tougher space to navigate from that as well. But wonderful points. I'm going to excuse myself. Thank you for giving me this opportunity to be part of the conversation. Omkar, you were very kind to call me part of the brain trust of Node. Ashish is the brain trust. I'm just the looks. So that's why I'm here. But look forward to partnering with you. Thank you, everyone.
Great. Thanks, Amir. And for everybody else, we appreciate, Mickey, Ronak, Omkar for leading this panel here at the trailing part of our initial day. Please, all of you in the audience, join us tomorrow. We've got a full day planned of these kind of great sessions. And then, of course, we have Friday as well. So we're kicking off with a keynote tomorrow at noon, and then same one on Friday. We'll have a closing keynote on Friday, bookended by two CEOs from hospitals. So hospital from Philadelphia, both of them happen to be from Philadelphia, not necessarily by design, but just how it turned out. They've got some great information to share with us. So please do join us tomorrow. Thank you for joining us, and we appreciate it.